Good afternoon, and thank you for joining us for today's briefing on the COVID-19 response. This briefing is being aired live on YouTube. Joining us for today's briefing are Tracy DeSalvo, the Director of the DHS Bureau of Communicable Diseases, and Dr. Ryan Westergaard, the Chief Medical Officer, also in the DHS Bureau of Communicable Diseases. And we'll begin today's briefing with remarks from Tracy DeSalvo.
Good afternoon, and thank you for joining us. I want to be sure to paint a thorough picture of the realities we are facing in Wisconsin. Here's where things stand today. We are reporting 11,574 new confirmed cases today, the highest single day of reporting throughout the entire pandemic to date. Yesterday, we reported 10,288 new confirmed cases, another record. Our 7-day average of new daily cases is 6,808. An increase of 85% since last month and over 200% higher than where we were just 2 months ago. The Omicron variant is spreading rapidly through our communities, and we are beginning to experience the effects. Today, we are also reporting that 35 Wisconsinites have died of COVID-19. Our total confirmed deaths have now reached 10,253. Our thoughts continue to go out to the families and friends who have lost someone to this pandemic. Here is what this increased case activity means for our healthcare system. Statewide, 97% of intensive care beds and 98% of immediate care beds are currently in use. There are 2,002 people currently hospitalized with COVID-19 in Wisconsin, and 464 of them are in the ICU. Hospitals are under tremendous strain right now due to COVID-19 and the Omicron variant. If you aren't experiencing symptoms of illness requiring immediate medical attention, please do not seek out COVID-19 testing at an urgent care or emergency room location. Instead, we ask that you please seek testing with your doctor, at a community testing site, or make an appointment for testing at a pharmacy or purchase an at-home testing kit. Using these other testing options allows hospital staff to take care of patients and reduces the risk of spreading COVID-19 to patients who are immunocompromised. Testing remains a critical tool to slowing the spread of COVID-19. Testing is encouraged if you have symptoms of COVID-19 or at least 5 days after you have had close contact with someone with COVID-19 if you do not have any symptoms. As you may know, there is an increased demand for COVID-19 testing right now, but there are still many ways to get tested for COVID-19 in Wisconsin. First, we encourage you to contact your doctor or primary healthcare provider to see if they offer testing. There are also a number of community testing sites throughout the state. These sites are experiencing increased demand, so we encourage you to plan ahead as much as possible, and please be patient with staff at those sites. At-home specimen collection kits are also available at no cost to Wisconsinites, regardless of symptoms or exposure, and you can find more information about how to order those at-home specimen collection kits on the DHS website. At-home rapid tests are also available for purchase over the counter at pharmacies and online. We know that at-home test kits may be in short supply right now, but pharmacies are restocking them as soon as they become available. You can visit the DHS website for help finding a community testing site. If you still need help finding a COVID-19 test, call 211 for assistance. Due to the increased demand for testing, it may take longer as well for you to receive your results. However, if you have waited more than 5 days, please contact your healthcare provider who ordered that test for you, or contact your local or tribal health department for assistance. While you wait for those results, it is important that you follow quarantine or isolation guidance. This means that you should stay home and monitor your symptoms until you receive your results. It is also essential that you continue to wear a well-fitting mask at all times when you are around others. The science of COVID-19 is always evolving, and as such, so do the recommendations for things like isolation and quarantine. Based on recent data related to virus transmission, including studies of the Omicron variant, CDC has shortened the recommended period of isolation and quarantine for the general public, including workplaces and K-12 schools. If you test positive, you need to stay home for 5 days. If you have no symptoms or your symptoms are resolved after 5 days, you can leave your house. You should also be sure to wear a mask around others for 5 more days. If you were exposed to someone with COVID-19 and are up to date on your COVID-19 vaccine, you do not need to quarantine. However, you should continue to wear a mask around others for 10 days. If you are unvaccinated or are not up to date on your vaccine series, you should stay home for 5 days to quarantine and wear masks around others for an additional 5 days. If possible, anyone with an exposure to COVID-19 should be tested on day 5 or later after that exposure. If you develop symptoms of COVID-19 at any time, stay home and get a test. This new guidance that was released does not apply to healthcare personnel, correctional institutions, or homeless shelters. Additional updates from these settings will be forthcoming from the CDC. In order to prevent further strain on our healthcare system, we can't do it alone. We're asking all Wisconsinites to help protect themselves, their loved ones, and their communities by doing the following: getting vaccinated, getting your booster shot if you're eligible, staying home if you're feeling sick, washing your hands frequently, and if you're experiencing symptoms or have been identified as a close contact, get tested for COVID-19. And finally, we are urging all Wisconsinites to wear a well-fitting mask in all public indoor settings. Each of us can take action within our own communities to help slow the spread of COVID-19. Thank you.
Thank you, and we're now ready to take questions. A reminder to maintain audio quality. Please remain muted until it is time to ask your question. And if you're able to do so, use *6 to mute and unmute your phone. In the interest of time, also to ensure everyone is able to ask a question, we ask that you limit yourself to just one question, please. And we'll begin this afternoon with Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, my question is for Dr. Westergaard. Doctor, from a purely epidemiological perspective here, do you see any sort of silver lining when it comes to Omicron, given that by most reports it does seem to be more mild? Is that an indication that it could be moving towards COVID becoming a more traditional endemic virus in the same vein as the flu? Thank you very much.
Yeah, thank you, Rob. That is clearly good news that as more research has been done, the picture seems to be getting clearer that the Omicron variant of the virus is less likely to cause severe COVID-19 and cause hospitalization. So that actually is a silver lining. It's, we always have to emphasize that it's possible for this virus to also cause severe disease, but for any given person, the risk of getting a common cold, particularly if you're vaccinated, is quite a bit higher than it was with Delta, which caused more severe disease. So that's, of course, good news. The counterbalancing bad news is that it spreads so much more easily. And as Tracy mentioned with our epidemiologic data, many, many more people are getting infected. And that will translate to, and is continuing to translate to full hospitals, and which brings our risk to all of us who might need emergency health care in the future. So yeah, I think we can breathe a sigh of relief that as many more people get COVID-19, the risk to any individual is smaller that they're going to get severely ill. But really, we're all experiencing this pandemic together in an important way, in that our hospital systems are really, really strained, and we need to do all we can to prevent additional transmission, because our hospital workers need all the help that they can get and not getting overwhelmed with more patients that they can't take care of in a timely fashion. So thanks for the question.
Thank you. Now to Annie Kroll from WBAY-TV in Green Bay. Annie. A reminder, *6, unmute your phone. Annie Kroll from WBAY-TV. Okay, we'll move on then to Gabriel Mays from Fox 6 in Milwaukee. Gabriel.
Yes, sorry, my apologies. I'm a little slow with the unmuting. My question is probably going to be for Dr. Westergaard. It's along the same lines as the question that you were originally asked. My question is, with more people getting vaccinated, or the amount of people that are currently vaccinated, as well as people who have had COVID prior, do you see with the Omicron variant, or possibly looking ahead with a new variant, do you think that enough people will be immune from what's next, or will this just kind of continue?
Yeah, I'm certainly hopeful that the pandemic is going to wind to a close after we get through this really bad crisis that's brought on by Omicron, which is causing unprecedented waves of new infections. That's really what our hope is. But I think an important thing that we learned from Omicron is that it's very, very difficult to predict what the virus is going to do. We were very lucky that when Omicron emerged as a genetically very different virus than we had seen before, and it's worse in a very important way that it spreads so much easily. But as I mentioned, it seems to cause less severe disease on average. So if this is one way that this wave of infection around the globe enhances our collective immunity, that would be good. But there's no guarantee that future variants might be worse in other ways. We're not protected. There's nothing that says that a future variant won't have the ability to evade our immune response, be transmitted highly easily, and be more dangerous. So that calls for really, I think, an increased attention to global vaccine equity and continued attention on preventing transmission of disease to minimize the threat that new, more potentially dangerous viruses will emerge in the future. So it's really a problem of not being able to predict the future. But I would say we learned an important thing with Omicron, that really significant changes in the genetics of the virus are possible. And as long as the virus circulates and is transmitted from person to person around the world, there's going to be some risk that happens. But hopefully we'll be spared more dangerous variants for years to come.
Thank you. Now on to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. I was just wondering, Wisconsin's been seeing pandemic records in the last few days, and there's also a very high positivity rate. To what degree are the records undercounts of how widespread the illness is in the state? Thanks.
Thanks very much, Sean. Of course, we know that all of the numbers that we have will be undercounts. There are people that are definitely using some of those at-home testing methods, which are not reported to public health. So the numbers that we have are certainly an undercounting of the cases that are happening in Wisconsin. But I think it's important just to emphasize that we really are seeing, even with the cases that are reported to us, just very significant case numbers, and it just really emphasizing how much circulation of Omicron we're seeing and the need for people to take appropriate precautions at this point in the pandemic. And Ryan, I don't know if you want to add anything.
Sorry. Thank you both. And moving on now to Alex Moe from WisBusiness.com. Alex?
Hi, thank you for taking my question. To mention that Omicron appears to be less severe than other variants of COVID-19. Are we seeing any evidence to support that here in Wisconsin? And if so, can you share those details? Thank you.
So I would say that we hear anecdotally from partners in healthcare that that patients that they're seeing are not different from what we're hearing globally. We do not have data analyzed in a systematic or rigorous way that address the question to know if Wisconsin's really any different. But what we're hearing from our first-line healthcare providers is they're seeing many people, lots of people coming into emergency departments who test positive, and many of them are mild and can be discharged. But overall, the number of people requiring hospitalization with COVID still is very high right now, higher than it's ever been. So it's that there's two sides of the coin. Many more people are getting infected, which the virus being even more, even if it is a little milder, there's going to be a subset who get severely ill. And if we have massive increases in the numbers of people getting infected is still going to translate to a lot of people with severe disease in the hospital, particularly people who haven't been vaccinated, and that continues to be what we see in our hospitals.
Thank you. Now to Todd Richmond from the Associated Press. Todd?
Hi there, can you hear me?
Yep.
Yes, you can. Go ahead.
A two-parter. I just want to confirm that that number of hospitalizations was 2002 today. Is that correct?
Yes, that's correct, Todd.
Okay. There's a lot of experts are now saying we need to stop paying attention to these case numbers. You know, there's a lot of sticker shock value here, but the real numbers are hospitalizations. Do you agree with that assessment? And should we be putting more emphasis now on the number of people that end up in the hospital rather than counting cases endlessly?
Well, I can take that first, and Tracy has good insights about this question too. But I disagree that we should not be paying attention to our case numbers at all. When you have something that's as complex as a pandemic that affects our society in so many different complicated ways, you need multiple perspectives. And knowing how many people test positive has been and continues to be a really important indicator of how much transmission is happening. So it's not going to be unimportant. At this moment in the pandemic, numbers of hospitalizations a more urgent indicator to look at? I would say yes. I think we should be looking at that number. We should be talking about that number because it's really high. It's too high. And the fact that it's so high is creating an unsafe situation for people who need medical care, because there's a risk of hospitals being too full to give everybody the level of care that we expect and deserve. So yes, I think that is the most important thing to think about right now, is what are we seeing in our hospitals and how can we support our hospitals and protect our hospital resources to be able to give everyone the highest level of care. But the number of cases tells us an important story, which is that Omicron is spreading faster than anything we've seen before, and that is important to track as well.
Thank you. Now to Megan Marshall from Spectrum News. Megan?
Hi. Hi, my question is, now that Wisconsin has access to these antiviral drugs, do we see that impacting hospitalizations across the state, and when might that trend into data where that's something visual we can see?
Yeah, we certainly hope these new medications that are out have a lot of promise to be able to prevent severe disease and keep people out of the hospital. So it's an exciting development. The question you ask is a really good one, which is when. And unfortunately, we have such a very small supply now, and will for the next few weeks, that it might not have a major or detectable impact on our hospitalization. But that being said, these are really important tools that can save lives if we use them in the way that has the highest impact. So just this week, we are starting to deliver them to pharmacies around the state, distributed in a way that we want everyone in all regions of the state to have as good of access to them as possible. And we need to communicate to healthcare professionals the importance of prioritizing these medications for the very highest risk patients, which are people who have very weak immune systems, who are unlikely to respond to vaccination, people who are unvaccinated, and people who are in the oldest age groups. So right now, the supply is so small that we really need to save them for that population. But our hope is that this, similar to what we experienced with vaccines, this early stage of having access to these treatments will be temporary, and we will have broader access to these eventually. But I don't think it's going to be in the next few weeks. I think the next few weeks are going to be very difficult in our hospitals. We'll use the medications as best we can, but they may not be enough to have a big population level impact. But that's a hope for the future that they will.
Thank you. Now to Rhonda Fox from WKOW-TV in Madison. Rhonda?
Thank you. I
have a similar question about the oral COVID-19 vaccines, Paxlovid and Molnupiravir. Which is a two-dose, and is the pill more effective than the shot? Thank you.
Okay, I can talk briefly about those two drugs. Paxlovid and Molnupiravir are both oral medications, not vaccines, and they are both administered as pills that you take for 5 days. So they work differently than vaccines. Vaccines continue to be our first line of defense from preventing people from getting COVID-19, and that is really the workhorse of our response to the pandemic, is getting everyone vaccinated, and that's still really, really important. These two new treatments, though, Paxlovid and Molnupiravir, are antiviral medications which we give to people who test positive for COVID-19 and have risk factors for having really severe disease that could result in hospitalization. And so they're prescribed as other antibiotics or antivirals would be, generally in the outpatient setting. And as I just mentioned, we need to make sure that we get them to the people who are at the highest risk of severe disease. Of the two, Paxlovid is the one that the studies show is likely to be more effective. It also happens to be the one that is in shorter supply. So there's a lot of communication going out to healthcare professionals right now and pharmacists, and we need to scale up the availability of these medications, but it'll take some time before they are widely distributed in the way that vaccines are today. And like I said, vaccines are really our key for preventing COVID-19. Preventing a disease is always better than getting a disease and then having to treat it. But they're very important tools that can treat people who are at high risk of severe disease.
Thank you. Now to Charlie Robuski from Fox 11 in Green Bay. Charlie.
Hi there. Can you hear me?
Yes, we can. Go ahead.
Hello. So testing sites out in Northeast Wisconsin are booking out days. What would you say to frustrated people who are waiting, days and days just to get a test to see if they have COVID or not?
Thanks for that question. For people who are looking for tests, we would encourage them, of course, to look to those community testing sites, but also to consider one of the many other testing options that are available to people in Wisconsin. So calling your healthcare provider to see if there's testing that's available through them, using an at-home test as well as an option, either a self-administered at-home test that you buy over the counter at a pharmacy or online, or using one of those vault tests that you can order from the DHS website. Those are shipped to your house for free. It's a PCR test, and you ship it back, and the test is run at a laboratory if you use that vault method. So there are a lot of options, and we know it can be frustrating and difficult to find a test, and we hope people will look at the many different ways that they could potentially get a test and find the access that they need.
Thank you. Now to Gabriella Bacharo from CBS 58 in Milwaukee. Gabriella. CBS 58. No reminder, *6, unmute your phone. Okay, we'll move on then to Ben Helwig from WSAW-TV in Wausau. Ben.
Good afternoon. Good afternoon. I was wondering, are you worried that at-home tests will skew the overall picture of COVID cases?
What we know is that at-home tests are a good additional tool in our toolkit to help people understand whether or not they have COVID-19 and take appropriate isolation precautions. Of course, we know that those cases won't necessarily be reported to public health, so we are potentially having more cases than even the DHS numbers actually reflect. But I think it's an important tool in the toolkit, and it's a good way for people to have access to diagnostics and understand their risk and the risk to their friends and family so they can take appropriate precautions.
Thank you. Now to Jay Stahl from WQOW-TV in Eau Claire. Jay. WQOW-TV in Eau Claire. Okay, we'll move on then to Brittany Slaughter from WAOW-TV in Wausau. Brittany.
Yes, thank you. What we're looking at is what have you guys seen as far as people getting COVID and the flu at the same time, and what are their options, and just what have you guys been seeing throughout Wisconsin? Thank you.
You know, we've detected some cases of people who test positive for influenza and COVID-19 at the same time. It's not very common, but it does happen. Both viruses can cause similar symptoms, and they can cause upper respiratory infection. They can also cause pneumonia. So if someone is diagnosed with both of those, the management would really depend on their risk factors. People who have other medical problems or risk of hospitalization or are older. We also have antiviral medications for influenza that can be used in addition to similar to the antiviral drugs we now have for COVID-19. So I would say it's a rare enough phenomenon that we don't know that it poses a greater or less risk of severe disease, but certainly it's a reminder and a signal that influenza is here as well, is transmitted through similar routes as COVID, and it is preventable with vaccination. So in this moment where we're so very concerned about our hospitals being full and wanting to do everything we can to prevent people from getting sick and getting into the hospital, it's a good reminder that the seasonal flu shot has been available for months. If people haven't gotten it yet, they still can and should, and can get them at most of the places that you can get other vaccines, at pharmacies and primary care offices and hospitals. So yes, getting vaccinated for COVID, boosted for COVID, and vaccinated for influenza this winter is going to be as important as ever. So I'm glad you brought that up.
Thank you. Now to Denise Lockwood from Racine County I. Denise.
Thanks for taking my call. I wanted to read a quote that I had from an interview I conducted yesterday with Dr. Michael Frank from the Medical College of Wisconsin. He said that we need to stop thinking of the vaccine as preventing infection, that the goal of the vaccine is not to keep you from ever getting anything, that it is to keep you alive. And it's like the old seatbelt thing, that seatbelts are not there to keep you from getting into an accident, they're there to keep you alive. So I wanted to kind of get your reaction to that.
Yeah, sure. Thanks. I agree to a large degree that the great benefit to our community, our state, for vaccines are to prevent severe disease. They do actually prevent infection as well. They're just far less than 100%. So the risk, and that's what the studies have shown, if someone is exposed to the virus, they are they're less likely to become infected if they're fully vaccinated and boosted than they were otherwise. Now, why I think Dr. Frank's point is important, though, is because COVID infections are so common right now. It's likely that most of us know someone who tests positive for COVID-19, even if they're vaccinated and boosted. Like, that's happening a lot right now. And his point is really important for people to understand, because the response to that shouldn't be, well, the vaccines don't work anyways, why should I get one? The response should be, look, the large majority of people who are getting positive, who are testing positive after vaccine, have very mild infections. And that is the power of the vaccines, even if they don't prevent all infections. And it continues to be true that the majority of people, the very large majority of people who have life-threatening COVID-19, who are in our ICUs, are unvaccinated. So yes, that should be the top-line message, is that vaccines save lives. They also happen to prevent infection, but they're not 100% preventing infections, but that's okay. We still need everybody to get one so we can keep our hospitals from getting overrun and save a lot of lives.
Thank you. Now to Carl Cooley from WJMC Radio in Rice Lake. Carl.
Hi, can you hear me there? Yeah, my question concerns the hospital case counts for adults as well as pediatric cases. If someone goes into the hospital with a non-COVID primary ailment, say like it's a traumatic injury or something unrelated, but they test positive for COVID while they're in a hospital, does that count as a COVID hospitalization or not? I kind of wanted some insight as to how that's kept track of.
Sure, I can address that. So they are counted if they test positive and they're in the hospital, regardless of the reason for their hospitalization. They get counted as a COVID associated hospitalization, and the reason for that is there's several reasons. One is the way we collect the data is we ask hospitals to report on a daily basis how many patients test positive among their inpatient population, and they do that on a daily basis. It's important to know how many people test positive, even if they're there for a non-COVID illness, because the type of treatment and the type of infection control measures that must be put in place and the use of resources is still very different in some important ways for people who are hospitalized. So people who are hospitalized with COVID, even if they have mild infection and are there for some injury, are still putting healthcare workers at risk and still require airborne precautions with N95 masks and respiratory protection protocols. So it is important to know the full number of people who are in the hospital with COVID for all our hospitals.
Thank you. Now to Kent Wayne-Scott from WISN TV in Milwaukee. Kent? WISN TV? And a reminder, *6 unmutes your phone. Once again, Kent Wayne-Scott from WISN. We have to move on then to, is that Kent Wayne-Scott? All right, moving on then to Man Silver from Milwaukee Public Radio. Man?
Hi there, good afternoon. So I have a two-part question. You mentioned that at-home tests are a good additional tool in the toolkit. What do you know about the rate of rapid tests not being accurate and people assuming that they're negative and potentially infecting others? And on that note, there was an alternate care facility in 2020, 2021, and I was wondering if there's been any talk of that now that hospitals are really full.
I can take a start at both of those questions. The first one about the I guess I would describe it as the sensitivity of at-home tests. We have some data describing that, although not directly, because we don't always have the results of the true at-home tests. But most of the at-home tests that are in use are the type of test that's called an antigen test. So the laboratory-based one that we're most accustomed with, called a PCR, tests that the genetic material are highly sensitive. The home-based tests are the antigen tests, which actually detect a protein on the virus. And when we've compared how antigen tests compare to PCR, they don't detect as many cases. So about 75% of the time, they will agree, but potentially 1 in 4 of people that test positive with the highly sensitive molecular PCR test will be negative on the antigen test. So that's important for people to know if someone has a clinical illness that resembles COVID very strongly, or if they've been in contact with someone that has COVID and they get symptoms. Having a negative test doesn't necessarily mean that they don't have COVID. They should look at the whole picture. They should consider getting an additional test 24 hours later, or following up with one of the highly sensitive molecular tests. So that's an example of why we think they're useful tools, because they can give us useful information. But it's important to, number one, use them exactly as the instructions indicate, and number two, know that they shouldn't be used as the only information to know whether someone should isolate or or seek medical care because they are imperfect. The second part of the question was about the alternative care site, and to clarify that, there's not currently a plan to operate a new a separate facility to take care of hospital patients. As Secretary Timberlake has explained in the past, a lot of our challenges are not related to a shortage of actual physical hospital beds, but rather the shortage of staff, nurses and physicians and techs and medical assistants who work in hospitals. So this time around, in the second year of the pandemic, the response strategy has really been to bolster our workforce to make sure that people can be cared for closer to home, which is what everyone's preference is. The state government has been working very hard in collaboration with federal partners with federal funding to recruit and train and place additional personnel to help with the strain on hospitals.
Thank you. Now to Logan Rogie from Wisconsin State Journal. Logan? Logan from the Wisconsin State Journal. Reminder, *6 to unmute your phone. Okay, we'll move on then to Sarah Volkenheim from the Milwaukee Journal-Sentinel. Sarah?
Hi, thanks for taking my question. I had a question related to nursing homes, and as we know, most nursing home residents are vaccinated, and many of them have been boosted, but at the same time, we've seen a lot of breakthrough infections with the Omicron variant, and nursing home residents are inherently very vulnerable to the virus and can get quite ill from it even if they've been vaccinated. I'm wondering how much of a concern, Dr. Westergaard, the Omicron variant is to nursing home residents, and how important is it that they do get a booster shot?
For the last part of the question, I think one of the clear messages, one of the clear things we've learned since we've discovered Omicron and it has taken over is how very important booster shots are. As we've talked about, the Omicron variant is, the way that it's different is it's genetically different, so its protein structures are a little bit different, and although it doesn't completely evade the protection of vaccines, the vaccines are a little bit less effective against Omicron than it was for Delta or the previous strains. Now, that difference, the studies that we've heard quoted are a 2-dose series of one of the mRNA vaccines may only be about 25% effective against the Omicron variant, but a booster dose of the same vaccine or one of the mRNAs can take the level of protection back up to over 70%. So they're very, very important to get maximal benefit from vaccines is to get the booster dose. And just this week, the CDC is emphasizing booster doses more and actually shortened the duration since the primary series, after which boosters are recommended. So now 5 months after completing the primary series, people are eligible for the booster instead of 6 months. And I think that was done in part to make sure that no one is going without a booster now, because we've learned that with Omicron, every ounce of immune system protection we can get is important. So I do agree that in nursing homes in particular, where we have a medically vulnerable population and cohabitation and congregate setting where transmission can happen, that boosters are probably one of our most important things, in addition to continuing all of the good infection control, some of the other measures. Some are doing, like limiting visitation. So it's a time to really buckle down and use all the tools we have to the best that we can now that the virus is spreading so widely.
Thank you. And there were some reporters that weren't immediately available when we started our briefing, so we'll go back around and see if they have rejoined us. And we'll begin with Annie Kroll from WBAY-TV in Green Bay. Annie?
Yeah, so my follow-up question is going to be in regards to the healthcare workers and specifically the strain that they've been really put under. I'm really curious when it comes to the American Rescue Plan Act and just increasing staffing for hospital workers. What are the plans for the DHS in terms of either temporary workers or full-time workers when it comes to dealing with this surge, especially at the start of the new year and just heading into January?
Thanks, Annie. I will point you to a press release that just went out this afternoon in regards to some of the staffing efforts that DHS has undertaken, and we're certainly happy to follow up and answer additional questions if you'd like to contact the media team about that.
Absolutely, thank you.
We'll be happy to help you out. Jay Stahl from WQOW-TV in Eau Claire. Jay? Once again, a reminder, *6, unmute your phone, Jay Stahl. All right, moving on then to Kent Wayne Scott from WISN-TV in Milwaukee. Kent.
Hi, this is Ken. Can you hear me?
Yes, we can now. Thank you, Ken. Go ahead.
Okay. Sorry, yeah, I was having a great deal of difficulty with the unmute. I apologize. Just kind of a quick two-parter, but more of from a personal perspective, can you comment on the 25+% positivity rate, 1 in 4 people? Is that in any way shocking to you? Did you ever anticipate that we would be at this level? And just kind of as a follow, you mentioned, Dr. Westgard, the weeks ahead being very difficult for hospitals. Do you expect this situation to get worse before it gets better?
So my view, and Tracy, you're welcome to share your emotional response as well. But no, I think that what we've observed with Omicron has been astonishing. How we've been dealing with SARS-CoV-2, the virus. We knew it was highly transmissible, much more so than flu. And to see, as these first 2 months of the Omicron surge have gone on, I think it has surprised everyone how quickly it spreads and how widespread. In this, despite all the what we've accomplished with vaccination and all we've learned, the fact that it's spreading this widely and our case numbers are this high, I believe is a surprise to everyone. And I don't know, Tracy, do you have any different thoughts than that? I forgot the second part of the question.
Yeah, I would agree, Ryan, and it's just amazing to see that 25% positivity, and we know Omicron is very transmissible. Some of this is probably related to holiday gatherings that happened as well, and just significant amount of transmission that have happened in Wisconsin. But it is, I think, as you said, just very surprising to see just how high that percent positivity is at the moment.
Yeah, the second part about could it, or do we expect that it'll get worse before it gets better? The modeling that I've seen in some places, anticipates a peak during early to mid-January. This always, it's always speculation. We really have learned that, it's difficult to predict. But when things seem to accelerate so quickly, a large number of people get infected, an optimistic view would be that, it'll go through quickly and it will peak and then we'll go down. So how far are we from the peak? We don't really know. Some of the national models have said that January will be a bad month all over, and it'll probably vary regionally where and when the peak is. I think for all of us, we'd love to see tomorrow be lower, and for today to have been the peak and see less and less in the coming weeks. I don't think we're confident that that'll be the case. It wouldn't shock us if we see higher case numbers this week and next week. But I think the message is let's all do what we can, following the guidance, staying home when you're sick, getting tested. We have some say over how high and